Dear Facebook Pure Urology viewers, good evening one and all. Today our topic is actually related to the lasers and their innovations. As you all know, for a long period of time, Holmium laser has been there, which served the purpose of enucleation of the prostate as well as the lithotripsy. But there was controversy that 30 watts is sufficient for the stone. There is higher watts not necessary. Previous to that, many lasers have been there, but they could not survive. But Holmium did not have competition for a decade or so. After that, Thulium fiber laser has come. Initially, it came from Russia, then India. Then once it got approved for FDA as well as CE approved, then the momentum from 2019 suddenly increased. And there is a lot of discussion. Now the papers have come. Even we have from our unit have written the first paper in Indian Journal of Urology, being first one of the users of Thulium fiber laser. But still, whether to go above 20 watts, whether above 30 watts is necessary, high frequency is necessary or not, these are all debates, and a lot of research is happening. Laser fiber sizes are decreasing, the scope sizes are decreasing, PCNL also laser usage is increasing. Taken this into account, it's an important tool for everybody who is practicing stone surgery as well as prostate surgery. To know more details, our speaker today is Dr. Esteban Emiliani. Previously also we have been with him. I know him personally because we are all related to the stone work, and he is also in the Petra group doing a lot of research work, being associated with Oliver Traxler sir and so on. Officially, I will introduce and hand over the program to him. Basically, today topic is laser innovations, and Dr. Esteban Emiliani is MD PhD FEBU. Currently, he is an attending urologist of the endourology and urolithiasis unit at Piguet Foundation and is a clinical associate professor at the University of Barcelona. His subspecialization studies in endourology and medical surgical treatment of kidney stones in two of the most prestigious institutions worldwide. First at the Tenon Hospital attached to the Sorbonne University in Paris under the tutelage of Professor Olivier Traxler, whom we know all. Second, he went to the MPUH Hospital in Nadiad, where he was under the tutelage of Professor Mahesh Desai sir, as we all know in India. He has published more than 100 articles, which is not easy, in indexed urological journals, 12 publications in non-indexed journals, and has written 4 international book chapters. He is a member of the editorial board of the World Journal of Urology, Spanish Urology Acts, Turkish Journal of Urology, and BMC Urology. Member and secretary of the Petra Group Research Group, led by Professor Oliver Traxler. With this, I thank Dr. Esteban for your kind acceptance to talk on the Pure. Your excellency in endourology will help us. As you know, 9,500 urologists are watching regularly the Pure Urology, and this YouTube link will be there forever. So please take your time. In between, if it is necessary, I will interfere. Otherwise, we will have questions at the end. There is no time limitation. Approximately 30 to 50 minutes we can take, and that will be very clear for the juniors about the laser innovations. Thank you very much.
No, thank you. Thank you very much. Thank you very much for the invitation. These Pure Innovations in Urology sessions are great. I'm really happy to be invited here and to be with all of you. Okay, so let me share my screen here. I'm going to talk about new developments on laser lithotripsy and laser technology for urolithiasis, and I'll be open to discussion afterwards. So first of all, we're going to talk about the gold standard, which is Holmium laser. For now, it's a gold standard. We will see if later on with the new laser technologies is going to still be the gold standard, or is going to be the gold standard in some sections of urolithiasis or of lithotripsy, because it has some competitors. But for now, one of the main advantages of Holmium laser is that it has been widely studied, the most widely studied laser in urology since '92. We have a lot of experience with it. It can be used in children, it can be used in adults, it can be used in any kind of kidney stone being very, very effective. So that's why it has become the gold standard, because of the vast experience that we have with it. Basically, it works as you already know, like this. It's holmium ions in a crystal jag in a small box with 2 mirrors, with a diode pump that emits white energy and emits some photons that rebounds into the mirrors and rebounds again and again and again, producing the energy of the laser. So basically, it's a production of photons. So the laser, it's basically light, which is emitted. The main difference between low power lasers and high power lasers is that low power lasers, it's a single cavity of the one I just described, can be used up to 30 watts of energy. And high powered lasers are multi-cavity lasers, more or less 4 of these cavities that I mentioned before. So they can take turns to produce high amounts of energy very quick. So you can have high energy and high frequency at the same time. We have 120 watts lasers for now, but now also we have 150 watts lasers, and there's no limit for this. So more or less, we can have 6 joules up to 120 hertz now, with having 120 watts of energy with these multi-cavity high power lasers. So this is the example. This is one of the, if you take off if you release the laser from the outer sheet, this is the 4 cavities working on the superior part of the laser here on top. And then you can see that the 80%, is just 20% of the laser. The other 20%, 80% of the laser, sorry, is just a water cooling method, because this increases a lot the temperature during the process of making the laser, and you need a lot of cooling, and it's a water cooling system. It takes just 80% of the laser. So with a Holmium laser, you can have lots of settings. First of all, you can choose your energy with joules. The more joules you have, the more ablation of the stone you'll have. Then you can set the frequency, which is the pulses per second, which has no effect on ablation, only with time. You just set your energy, and you can increase the speed of your laser lithotripsy with frequency, pulses per second, as you know. And then you can choose the pulse, which is basically initially was short pulse and long pulse. Short pulse, you emit one single pulse of energy very quick, let's say 200 microseconds. Or long pulse, this single emission of energy, you can deliver the energy in a longer period of time, 800 microseconds, for example, and this decreases the ablation. So short pulse it creates more ablation. Long pulse, it creates less ablation. So it's better for dusting, for example. This is the difference between short pulse and long pulse. When you see the laser, let's say the laser emission in oscilloscopy, short pulse has a steep peak power here, and then decreases constantly until it is over the emission of the energy. The long pulse, doesn't have this very, very high peak power of energy. It's lesser. It remains for more time steadily, and then it decreases the energy. So the long pulse, it's better for ablation, just because it doesn't have this very high peak power of energy. So the optimal laser settings, as I mentioned, it was low peak power pulse, so low energy and long pulse. And you can set up now high frequencies or increased frequencies to speed up your dusting. So what happens? What have happened in the last couple of years? We have new generation Holmium yak with new pulse modulations that have shifted a little bit the game here. First, we had the standard pulse. It was a single pulse, a single bubble emission. But now we have multi-pulse, multi-bubble emissions of energy. This is the new pulse modulations. In the same amount of energy is delivered in different ways. So it has different multi-pulses. So we have this multi-bubble effect, as I mentioned. We did a systematic review on this, and we reviewed all the pulse modulations in Holmium lasers, and we're going to discuss this now. First of all, is the MOSES technology. It was the first one to be on the market. Is a multi-pulse, multi-bubble emission, double bubble. In fact, it can be set in MOSES contact or MOSES distance. I said basically most of my dusting in MOSES distance because it has the same effect as the long pulse. It just takes more time to deliver the energy. It lowers the peak power, so it has less ablation, and it's better for this. You can see here the regular pulse, multi-bubble pulse, and the double pulse emitted by the MOSES technology. Basically, it emits 1% of the energy to create the bubble, and then the rest is emitted later on to avoid losing energy in this creation of the bubble, and try to make all the energy go to the stone with a longer, let's say, effect. Now with the MOSES 2.0, what we have is that we have extended frequencies. We can set the frequencies up to 120 hertz, and the laser would set itself to what they call optimized MOSES, which I think it's basically the same MOSES technology in MOSES distance. We need to take into consideration that the MOSES technology, which is a branded and patent in a patent, is not the same as the MOSES effect, which is simply the creation of a bubble by the laser that simply separates the water to allow the energy to touch the stone. That's it. This is the basic MOSES effect. If you compare in oscilloscopy the short pulse to the long pulse that I already mentioned, then you can see the MOSES contact, which is just the double emission of the energy that resembles in energy delivery the long pulse here. It has the same height. It's just you have a double emission of energy. And what is the best benefit of this MOSES technology regarding all the literature that we have is that it reduces retropulsion. So it increases the chance for you to be close to the stone and have a better efficiency. If you compare here MOSES distance compared to the other settings, you have in green the high peak power of short pulse, in red the low peak power of long pulse, and then you have in black the double emission of the MOSES technology. Then I wanted to show you this because then you'll see that the Thulium fiber laser, which is the blue one, it has the lowest energy of all, at 4 times lower energy compared to the lowest peak power of Holmium, which is long pulse or MOSES technology. The other pulse modulations that we have is from Quanta system. We have compared to the normal pulse, we have the virtual basket, which is also a double pulse emission. It's very similar to MOSES. And the vapor tunnel, which is you can see in the first video, is a multi-bubble, multi-channel emission of energy. That the basic, let's say, the basic principles of this laser says that you can reach further a stone that is further from you, but it's just a small amount of distance. But these are the basic multi-pulse technology from Quanta system. This also has shown to have reduced retropulsion compared to normal pulse, as you can see in the video. And when you use it in a clinical practice, you can see that it's very, very good. You can dust hard stones with 1 joule, 20 hertz, and vapor tunnel, which is my preferred setting for calcium oxalate monohydrated stones, as you can see. Or you can choose lower energy with vapor tunnel to dust very soft kind of stones. This technology has shown, this multi-pulse technology has shown to be more to be very effective, especially in soft stones, as you can see, as you can taste in a clinical practice. As for the comparisons between vapor tunnel and virtual basket, we know that at 2 joules, 20 hertz, virtual basket has higher ablation compared to a vapor tunnel, according to this paper by Ballesta and Dr. Liatzikos. I usually use vapor tunnel for my dusting when I'm using the Quanta system. We actually did an in vitro experiment in our hospital with Vega stones, seeing the Quanta system and seeing which was the penetration of all the lasers, comparing short pulse, long pulse, vapor tunnel, and virtual basket. And what we saw is that it has a very, very similar setting as long pulse. So to be very, very effective with all these pulse modulations that we have, for me, I think the key message for Holmium laser is to use low peak power. If you have pulse modulations, you can use any kind of pulse modulations, use low energy, and more or less as you can use as high frequency as you want to be very effective. Always touch the stone to be at least to 0 to 1 millimeter distance to the stone to be very effective, as we saw in this video, and to move constantly around like painting the stone. If you move constantly and you are very in touch with the stone and use low peak power, you have the best dusting that you can have. We have this paper also saying that with this settings, using Moses distance in a in vitro study, you can have more ablation, but this is not clinical studies, it's just in vitro studies. Other energy sources in the market, as the stabilization mode by Olympus have been described, or the advanced mode by Dornier have been described, but there's no studies, only one in vitro studies from the Dornier and no studies for the Olympus one, and we cannot give any recommendations or make any comparisons between them. So what did the systematic review saw about all that we just mentioned? First, that stone-free rates were very similar, comparing new pulse modulations. Operative times were very, very similar as laser time and complication time. So for now, we need clinical studies to say that these new pulse modulations are good or efficient compared to what we have before. What I can say is that low peak power is needed for dusting. And this is I think the message. If you have pulse modulation, if you have low peak power, you can use low peak power, and you can use long pulse, you can use whatever you have to have a good, efficient dusting lithotripsy. Moses distance have proven to be better than vapor tunnel, but equally to long pulse. Vapor tunnel better than regular mode. There's a lot of studies, in vitro studies, saying that one thing is better to the others. But I think for now we need to acknowledge that there's a lack of clinical studies, and we cannot give an actual best recommendation comparing all the pulse modulations that we have. I think the dusting has to be with low peak power settings, as I mentioned, either with either laser generator that you have. Use less because you have less retropulsion, better dusting, low fiber damage, and you can be always in touch with the stone and move constantly, and you'll have the best efficiency as you have. I think one of the best features of high peak power lasers, that it's really the importance of this laser in lithotripsy, I guess, is the use on PCNL. We use laser for PCNL always. You can see here the efficiency of PCNL with high power lasers is really efficient, really comparable with other systems. And I think the high peak power is very useful and is mostly useful in PCNL for Holmium laser. And now with the extended frequencies, well, you can choose whatever setting you need for this. This is 0.6 joules with 100 hertz and optimized MOSES. And you can see that the fragmentation is very optimal. Okay, this is regarding lithotripsy, but what about Holmium laser and coagulation? We know that there's an ablation area and a coagulation zone according to what we saw in this experiment. And the higher the energy, the deeper the incision. We know this, and the higher the frequency, the deeper the incision. But more or less, you can say that these are very safe lasers, and the penetration depth, the theoretical penetration depth of 0.4 millimeters, it just means that at 0.3 millimeters from the tip of the fiber, 50% of the energy will be absorbed by water. It doesn't mean that it doesn't penetrate more than 0.4 millimeters. That depends on the setting that you choose. But normally at 0.4 millimeters, 50% of the energy will be absorbed by water. So you can treat very well soft tissue, as for example, tumors with 1 joule, 10 hertz and long pulse. I think this is a very good combination for this kind of settings. Now it has more bleeding because it has a higher peak power. Lower peak power has better coagulation, but it has more necrosis and it has less necrosis than thulium fiber, as you can see here. So this is what we know now, and these are the most advanced, the advances of Holmium lithotripsy for now, which is basically new pulse modulations, but we need more studies on this. Now we have the thulium fiber laser. There's a lot of thulium fiber laser now on the market. It has been in the market since 2018. It's basic to understand that thulium fiber is not thulium YAG. Is a completely different setting. Thulium YAG is similar to Holmium YAG. Thulium fiber is just a 30-meter long fiber that it's pumped by 3 diode energy settings. This fiber contains the thulium ions and it emits the energy. So it's a completely different laser. You saw the Holmium YAG laser, which the multi-bubble or the single bubble cavity. This is a complete different setting. It's just a super pulse. It's a pulse wave laser, but it is very very quick and very powerful. The source of this setting. As it's a pulse laser, you can also choose joules, frequency, and pulse modulation, long, mid, and short pulse, because it's just pulse. You can choose the energy, the frequency, and how fast you want to deliver the energy. So exactly the same as the other, but the setting range changes because you can have very low joule setting and very high frequency setting. Theoretically, it's up to 2000, but in the regular practice, I don't know if we use more than 100 hertz. And you can choose the energy setting long, mid, and short pulse. As a basic recommendation for lithotripsy, always use short pulse for thulium fiber laser. This is the basics. We can use smaller laser fibers compared to Holmium. We use in the clinical practice fibers up to 150 microns with TFL. This increase the irrigation, reduce the retropulsion, you have better deflection, you have less breakages, so it's safer. You can have less backburns, and you can have smaller dusting particles. So using a small fiber is always the best option. You have minimal retropulsion according to all the studies and recent studies. And you can see that according to the physical principles, the penetration depth is very, very small, 0.07 millimeter, which means that it's a very, very safe laser. As I mentioned before, at 0.0777 millimeters, which is nothing, 50% of the energy will be absorbed by water. So these are very safe lasers. All of them has a very good safety profile. At 1 millimeter distance, there's no energy, basically in any kind of laser that you use. It has a very good coagulation profile because it has a very, very low peak power, as I mentioned at the beginning. Lower peak powers have better coagulations, so you expect less bleedings. You can treat tumors. You can do enucleations with this, and you experience less. You'll experience less bleeding from this. These are my preferred settings for dusting. They are very similar to Holmium, but as I mentioned before, is not the same laser. I don't know. Maybe there's some kind of confusion because when you write articles for TFL, most of the reviewers ask you to have similar settings, but I think you may have similar power, but the energies are completely different. For soft stones, I use low energy, 0.4 joules. I can use more or less 40 to 60 hertz if I see very well, and always short pulse. But I think the important message is to use low power, let's say less than 25 watt, to avoid have increased temperatures. You can use the same setting, 0.4 60 hertz short pulse, for dusting and for popcorning. In my clinical experience, popcorning is very, very good with TFL. In a very short amount of time, you can have you can dust completely all the particles that you have. You can also choose higher energy, 0.6 and less frequency, 0.6 and 20 hertz, for example, 0.6 and 10 hertz. This also will be very useful. It more or less stands in those ranges. For fragmentation, you can use increased energy, 1 joule and 20 hertz. This could also be a very good setting for dusting hard stones. Increase the energy to 1 joule and use 20 to 40 hertz and short pulse. Always remember to be in the safe side and to have less than 25 watt for this. And for the ureter, remember always to use low power. Low power, less than 10 watts, to avoid increasing the temperature in a small space that will probably increase the risk of strictures, or in decreasing the chance of your laser tip to hit and to touch the mucosa. Because if you have high frequency, maybe you will touch the mucosa and you have more risk of having strictures. So always be in the safe side and use very, very small amounts of energy in the ureter. Try to break the stone and get out of there as quick as possible. So for the temperature, use low watts in the kidney and the ureter, less than 20-25 watts in the kidney, less than 10-15 watts in the ureter. And use continuous irrigation, intermittent laser activation, and if you use an access sheet, for example, try to see the outflow, have a non-obstructive scenario to reduce the temperatures using these settings. Most of the studies are in vitro, and we know that TFL has better ablation compared to Holmium YAG, quicker ablation, 4 times better. In clinical settings, you can be 2 times faster. In studies, in my experience, you are faster with TFL. and you can have smaller fragments to aspirate later, or to allow them to go away easily. This is very good because it opens the door for the future to have aspiration systems. There's a recent, not that recent now, 1 year, a randomized control trial, TFL versus low power Holmium laser, and TFL was better than low power Holmium lasers, 30-watt Holmium lasers, better operation time, better stone free rate, and similar complication rate. So this was very good to know. But this year, recently, 1 month ago, we have a new randomized control trial comparing high power, or more than high power, multi-pulse Holmium YAG versus TFL, multi-pulse using multi-pulse double bubble, as I mentioned before, and the stone-free rate, OR time, and complications rates were very, very similar. So this also is indicating that maybe Holmium YAG, multi-pulse Holmium YAG can be a very good competitor to TFL regarding flexible ureteroscopy. This was very important. The advantages of TFL is that you have a very, very low peak power, so very low retropulsion. As you can see here in the blue line, the energy is completely square, so there's no peaks. So all the energy is constantly being delivered to the stone. So you have always energy touching the stone. Is not just a peak, with all the energy is delivered to the stone. It's continually delivering. You have longer pulse duration, so more energy delivered to the stone compared to Holmium, and high water absorption. So these are the main advantages of TFL on rears and why it works very well. Now, the new kid on the block is the pulse Thulium YAG. The pulse Thulium YAG, it works exactly as Holmium YAG, a multi-cavity with the crystal and thulium ions. It used to be continuous, so it used to be you could just set the watts, the power for Thulium YAG, and use it in soft tissue. But now we have the pulse laser, and very recently we could use it in stones. Remember that you need this pulse laser. You need to hit the stone constantly to break a stone. It cannot be a continuous laser to break the stone. We have two devices on the market: the Lisa and the Revolix HTL from Lisa Laser, and the Thulium from Dornier. We have seen that it's basically multi-bubble or multi-pulse emission of energy. You can see the two bubbles being emitted. We have seen in vitro studies that there's a suctioning phenomena. You see that the bubbles just goes behind the laser fiber. So probably it has a suctioning phenomena that will help retropulsion. We have to see this. You can set maximum 4.5 joules, 300 hertz, a pulse duration that can be from 50 to 100%, so short and long, basically. And you can have up to 150 watts. And this is basically to mention that 50% will be long pulse and 100% will be short pulse. So it's exactly the same. And what is very interesting regarding the pulse Thulium YAG is that the peak power lies just in between Holmium and TFL. So maybe this will be a good source to do everything that we want to do with a high power laser, for example, PCNL, and everything that we want to do with a low peak power laser, basically flexible ureteroscopy. So it's an in-between energy. So we are very eager to see the clinical experiments to see if it works. You can see here a Thulium YAG, a pulse Thulium YAG dusting setting is basically similar to Holmium, 0.3 joules, 50 hertz, and mid peak power. It works perfectly. As for fragmentation, it works very well here. Very similar settings, and it's Also a very safe laser, 0.25 penetration depth. So it's very safe, and it's very good for coagulation compared to Holmium YAG. Why? Because it has lower peak power, as I mentioned before. So it can also work very good for soft tissue. And with the Thulium, pulse Thulium, in the generators, you can also choose the continuous wave. So you can choose both regarding the surgery that you need. In a continuous wave, the more energy that you have, the more incision penetration, and the more but the coagulation is not related to energy. This can be this is stable. It's very good to use. The continuous wave is very good to use with tumors. We have to see if the pulse wave can be used with tumors. What we do in our center is that we use continuous wave to let's say reduce the papillary tumor to avoid bleeding, because the coagulation again is better than Holmium. And then with Holmium, the pulse wave would just remove this cotton-like tissue to really try to treat better the tumor. As for the temperature, we know that as the high power Holmium is it's comparable to Thulium YAG, to continuous wave Thulium YAG. It increases significantly the temperature just on the side of the treatment and on the axis. This is something that we published recently. So we will see there's no evaluations for now. There's only in vitro studies, 8 in vitro studies regarding the pulse Thulium, the pulse Thulium YAG. They say they are comparable to Thulium fiber, and in some cases better than Holmium YAG for lithotripsy, but we still need the clinical data to say that. The fact that they are comparable to Thulium fiber is just, I think, because they have low peak power settings. So just to end the presentation with some characteristics, the Thulium and the TFL are good because you can connect them in a common plug of 5 amps. You don't need special installations or special 40 amps super plugs. As for the Holmium setting, as I mentioned, it consumes a lot of energy because it has a water cooling effect. The other ones are air cooling, so it's better. Thulium fiber is small. Newer Thulium fibers have wheels and are a little bit bigger than some machines. And this is better because it just helps you to move it around the OR, so it's handy, because these small devices at the end, you just put it in a table with wheels. So it is smaller, but you need a very practical generator. So new TFLs have wheels. You can see the difference between here. They're less heavy, but again, they're doing it in this side, and they are very, very small continuous wave continuous Thulium YAG lasers. So that's it. These are the new technologies. These are the new. This is the new data that we have. Very, very, very promising lasers. We're having more and more, let's say, studies with Thulium fiber. It is on the way to become the new gold standard for Holmium, for flexible ureteroscopy, at least. There is new data comparing mini PCNL, Holmium, and TFL, saying it is similar, but there's only just a couple of studies, so we need to be very certain of this. It was very interesting to see the randomized control trial saying that multipulse Holmium YAG was similar to TFL, so we'll see what happens. There's a very promising new technology with the pulse Thulium YAG laser. The fact that it's in between Holmium and TFL, it may open the door just to have one laser to do both PCNL, for example, and PCNL continuous wave and a good flexi urethropscopy. So we'll see the clinical trials, what they say. And we're still using, I'm still using in a daily based, in my daily based practice, Holmium YAG. You can use for any kind of stone, low power settings. I think high power settings are very good for PCNL, and because you have the pulse modulation, but any kind of low power, low peak power, it's useful. I think this is a good message. And this is it. Thank you very much.
Thank you very much. Fantastic presentation. Let's have brief chart. I will ask some questions relevant to this. The first question is, if the pulse width is long, then does the Moses technology, not the Moses effect, Moses technology has any extra relevance? For example, TFL naturally has long pulse width, and you have adjustment in Holmium laser for long pulse width. If the width of the pulse itself is very long, does it have any extra advantage of two bubbles going onto the stone in dusting in terms of retropulsion? Why this is made separately with the luminous? At the same time, does it have an extra advantage in lifting the tissue in prostate more than this lithotripsy?
Okay, so this is a very interesting question. What we have seen in studies is that the double pulse from Moses distance has lower retropulsion. This is in vitro studies, yeah, has lower retropulsions compared to regular pulse or short pulse, even to long pulse. But these are in vitro studies. This is the problem, that maybe in a clinical setting they are not very relevant, and this is what we need to know. Okay, so this is the first thing. Second thing is just a bit the energy emission. The double pulse is just a bit longer than long pulse.
Okay.
So we don't know if it's better. It's just a bit longer. The real difference is between this and Thulium fiber, where the energy is really, the pulse duration is really longer than Holmium. TFL pulse duration is really long, is longer, is 2, 3 times, 4 times longer than Holmium. So there's a constant energy emission to the stone compared to Holmium. Yeah. But this is what we need to check out with the clinical studies, because these are just the oscilloscopes, and this is what we're seeing in vitro. But we really need to see if this is representative in a clinical setting. It looks like TFL, it's great and it's better, but now we have this new randomized controlled trial that says that maybe it's equal. So we will just need to know. In theory, what is good about TFL is that the emission is very, very, very low peak power, and it's very, very, very long, that it's squared. It's not a peak. Yeah. It's just a small elevation and it's square. So this is very good.
My second question.
And related to BPH, what I've seen with my colleagues that do BPH constantly is that Holmium, it's better than the other pulse modulation, than the other laser settings, because this high peak power emission of pulse emission, it really separates the tissue, and you can get a plane. They said that for your learning curve, this is way better. Than once you know how to do it, you can use continuous wave or TFL or other sources, because you know where you are. but the best laser to learn and to really see the plane will be in this time Holmium. We'll see if pulse Thulium YAG will cover this also. It looks like, but we'll have to see.
Yeah. So second question is, if you have 1.5 centimeter stone in an calyx, a lot of discussion is there on the dusting with low energy, medium frequency. At one point of time, the stone breaks into pieces and you have to go for pop dusting at the end.
Mm-hmm.
After the TFL has come, because of high frequency, in the beginning only, you make fragments deliberately. You make the fragments deliberately within short time with high energy, low frequency, then directly go to popcorn without any dusting. You break like pneumatic lithotripter in a closed cavity and then use popcorn. Very short time, the powder is formed and the powder quality is also as equal to a dusting from beginning. So if at all you have a closed calyx, this may not be applicable for pelvic stone because pelvic stone you can't fragment from beginning, they may disperse. Or in a dilated system, it may not be possible. I hope you are understanding my question.
Absolutely.
Continuous dusting till the end with a real good technical skill versus no technical skill, make random pieces, just keep the fiber in the center of the cavity and just hand activate. No real good hand technical skill needed, especially after the TFL has come into picture.
I'm going to tell you what I do. For flexible ureteroscopy, I mainly use TFL, okay?
Yeah.
So what I do is I try to dust the stone as much as I can because I'm doing very fast, very good micro dusting.
Okay.
So I'm ensuring that my dust quality is the best to be eliminated. So this is what I do. And once I reach a point that I cannot dust because the stone moves too much and it breaks just into small pieces, it is already very small, and then I do popcorning. Maybe with the same setting, I just keep being in between the stones and firing the laser intermittently to avoid a high power. And with this, in a couple of minutes, you have very, very, very small particles. But it takes time, and it also takes a little bit of luck because you want to be really in between the stones. So this is why I don't like to fragment initially and do this pop dusting.
Okay.
I like to do all the way because it's fast and it's very efficient. Okay. I also like the Holmium YAG for this. When I use Holmium YAG, I have the privilege to have the luminous and the quanta. I use pulse modulations, and I do exactly the same. I try to dust completely the stone and then do sorry, and then do popcorning at the end. I do exactly the same. I don't like the pop dusting technique because I don't like to use high power for this. I think with a good technique, you can avoid having high power and just needing the high. With a good technique, you don't need you don't need the high power at the beginning. You know, you can do with a good technique, you can do a very good dusting and then do a very good popcorning and have a very, very good let's say effect or micro dusting. With the other way around, you are mostly dependent on the laser to do this high power to create this high motion and smaller fragments with this really, really, really high power. So you are depending on this on the energy for doing this, and let's say being a bit of risk theoretically to increase the pressure, to increase the energy, to do this to do this technique. So my technique will be the first one.
In
Personally.
PCNL, for a large stone in PCNL, hard stone, if you are using 15 to 18 French access, the Ampla sheet,
yeah,
a lot of people are using laser. The original technique of PCNL lithotripsy with pneumatic is intelligently break the stone to such a size that it will fit into the Ampla sheath and take it out as less number as possible.
mm-hmm.
Once the laser comes, you are trying to make smaller pieces, arguing that they will come out naturally from the Ampla sheath. But this dispersion of the small pieces can lead to low SFR. And where are we heading towards? In a pneumatic lithotripter, everybody breaks into a big piece, adequate to take out. You feel happy that you have not dispersed anything. Whereas when you use laser, if it is less than 1 centimeter, fine. Then in that way, RIRS is also okay. But if it is more than 4 centimeters, how many pieces ultimately you take out in the container at the end? 1,000? 500? So what's the way?
Yeah. So it depends on the technique you're using and the stone, basically. A soft stone, if you're treating, for example, 4 centimeter uric acid, 5 centimeter uric acid stone, if you use 2-3 joules, 30 hertz, for example, and now it's no problem. This is very typical for us, 18 French Amplas sheet, 12 French nephroscope. So we have a lot of outflow, a very good inflow. So there's really low pressures and low temperatures all the time. So we can use this kind of settings. We do this high power dusting. So it's mainly dust the stone. It's completely dusted very, very quickly, and it comes out very, very easily. Once we reach a point where you cannot dust the stone, same setting, we just break the stone is in big pieces, as you mentioned, as big as we can, as big as possible to take them out as quick as possible, and to take them out even with the Venturi effect. So we still use the technique of these big pieces. In fact, what we tell our resident is don't do small pieces, because then to take them out is very difficult. This is the technique with the laser. Yes. It's very similar, but we do this high power, let's say, this high power dusting, which is even with hard stones, it's the same, which is really, really efficient.
Okay. In RIRS, when you are doing large volume stone, the amount of the dust you see is lot. Do you recommend repeated withdrawal of the scope and wash this dust? As of now, we don't have any official information on suction effectively, either outside or inside. What is the technique you recommend to remove the dust, or you leave it like that?
The technique, I'm not using any suction devices, if I'm honest.
Okay.
I just try to do my best to relocate the stone, to really, really dust the stone, micro dust the stone. I'm very, very happy with my stone free rates. If I tell you the truth, I know that I can be better. I know that the suction will increase the maybe stone free rates, maybe stone size treated. Maybe we can increase our settings now because of safety. But I haven't found, even there's very good articles on things that you can do, like on things that you can do in your small practice on trying to aspirate. I haven't found a technique to really aspirate the stone. Sometimes I aspirate with a syringe, that's for sure, but nothing more.
Thank you very much for such a detailed discussion on the lasers. You all have been doing great academics research, and so many papers in 2022 we have published. Wish you will do more and bring more science. Today, actually, I have learned about the Thulium YAG recently going to come. No
Great.
paper has yet published, but pulsed Thulium can again be one more game changer. Let us see how it is going to be. Thank you very much. So nice discussion. And this YouTube link will be there.
Yeah, thank you very much.
Thank you very much. Thank you very much.
Thank you very much for the invitation. It was great.